Shingles. What you should know about it. Shingles, also known as herpes zoster, is a viral infection that causes a painful rash. It is caused by the varicella-zoster virus, the same virus that causes chickenpox. After a person has had chickenpox, the virus can remain dormant in the nervous system for years. In some people, the virus reactivates later in life and causes shingles. What are the symptoms of shingles? The most common symptom is a painful rash that usually appears on one side of the body. Other symptoms of shingles include 1. Tingling or burning sensation. Before the rash appears, many people experience a tingling or burning sensation in the affected area. 2. Red rash. The rash typically appears as a band or patch of red, fluid-filled blisters that can be very painful. The rash usually appears on the torso, but it can also appear on the face, neck, or scalp. 3. Itching. The rash can be very itchy, and scratching can lead to further irritation and infection. 4. Headache. Some people experience a headache when they have shingles. 5. Fatigue. Many people feel tired or run down when they have shingles. 6. Fever. Some people develop a fever when they have shingles. 7. Sensitivity to light. Shingles can cause sensitivity to light, which can make it difficult to be outside or in bright rooms. If you suspect you have shingles, it's important to see a doctor as soon as possible, as early treatment can help to reduce the severity and duration of the rash and alleviate the pain. What causes shingles? Shingles is caused by the varicella-zoster virus, which is the same virus that causes chickenpox. After a person recovers from chickenpox, the virus can remain dormant in the nervous system for years. In some cases, the virus can reactivate and travel down the nerve fibers to the skin, causing a rash and other symptoms characteristic of shingles. There are a number of factors that can increase the risk of developing shingles, including age. Shingles is more common in older adults, especially those over the age of 50. Weakened immune system. People with weakened immune systems, such as those with HIV or those who have undergone chemotherapy, are at higher risk for developing shingles. Stress. Stress can weaken the immune system and increase the risk of developing shingles. Certain medications. Medications that suppress the immune system, such as steroids, can increase the risk of developing shingles. History of chickenpox. Anyone who has had chickenpox is at risk of developing shingles, as the virus remains dormant in the nervous system. Gender. Women are slightly more likely than men to develop shingles. Shingles is not contagious, but it can be spread through direct contact with the fluid from the blisters of a person with shingles. Are there complications of shingles? There can be complications of shingles, especially if the condition is not treated promptly. Possible complications of shingles include 1. Postherpetic neuralgia. This is the most common complication of shingles, and it can cause severe, long-lasting pain in the area where the rash occurred. 2. Vision loss. If shingles affects the eyes, it can cause inflammation and swelling that can lead to vision loss. 3. Neurological problems. In rare cases, shingles can lead to neurological problems such as encephalitis, meningitis, or facial paralysis. 4. Skin infections. The blisters that form during shingles can become infected, leading to further complications. 5. Scarring. If the rash is severe, it can leave scars. 6. Weakness. Some people experience weakness or paralysis in the muscles near the rash. 7. Hearing or balance problems. Shingles that affect the ear can cause hearing or balance problems. The risk of complications is higher in people who are older, have weakened immune systems, or have underlying health conditions. Is shingles contagious? Shingles is not contagious in the sense that it cannot be spread through casual contact. However, the virus that causes shingles, varicella-zoster virus, can be spread through direct contact with the fluid from the blisters of a person with shingles. If someone who has never had chickenpox or received the chickenpox vaccine comes into contact with the fluid from the shingles blisters, they may develop chickenpox, but not shingles. Once a person has had chickenpox, however, the virus remains dormant in the nervous system and can reactivate later in life to cause shingles. It's important to avoid contact with people who have shingles if you have never had chickenpox or if you have a weakened immune system. If you have shingles, it's important to keep the rash covered and avoid contact with people who have not had chickenpox or the vaccine. There is a shingles vaccine that can help prevent shingles or reduce the severity of the condition if it does occur. The vaccine is recommended for adults over the age of 50, regardless of whether they have had shingles in the past. There are two types of shingles vaccine available. 1. Zoster vaccine live or ZVL. This is a live vaccine that is given as a single injection. It is recommended for healthy adults over the age of 60. 2. Recombinant zoster vaccine or RZV. This is a non-live vaccine that is given as 2 injections, 2 to 6 months apart. It is recommended for healthy adults over the age of 50. Both vaccines are effective at reducing the risk of shingles and the risk of postherpetic neuralgia, which is a common complication of shingles. The vaccines are generally safe, but they can cause side effects, such as soreness at the injection site, headache, or fever. If you are over the age of 50, talk to your doctor about whether the shingles vaccine is right for you. Shingles diagnosis. Your doctor can diagnose shingles by asking about your medical history and your symptoms and by doing a physical exam. They can also test a small sample of fluid from your blisters. Treatment for shingles. There are several treatments available for shingles, including antiviral medications. These medications can help reduce the severity and duration of the shingles rash, as well as the risk of complications. They work best if they are started within 72 hours of the onset of the rash. Pain relievers. Over-the-counter pain relievers such as acetaminophen, ibuprofen, or naproxen can help relieve the pain associated with shingles. Topical creams. Creams or ointments containing capsaicin, lidocaine, or numbing agents may help relieve the pain and itching associated with shingles. Calamine lotion. This can help relieve itching. Cool compresses. Applying cool, damp compresses to the affected area can help reduce pain and itching. Rest. Getting plenty of rest and avoiding stress can help your body heal more quickly. If you have a severe case of shingles or are at risk of complications, your doctor may recommend additional treatments, such as corticosteroids, anticonvulsants, or antidepressants. It's important to seek medical attention if you suspect you have shingles, as early treatment can help reduce the severity and duration of the condition, as well as the risk of complications.